Hello, my name is Paul Myers and I'm Medical Director of Doctors Appraisal Consultancy, and I'm bringing you today a short video explaining how you can arrange patient and colleague feedback for your appraisal. As you will be aware, this requirement is only once every 5 years during your revalidation cycle and is quite easy to arrange using the MyL2P appraisal system, which has a module that specifically addresses the need for patient and colleague feedback. Once you are registered with MyL2P, you simply have to follow the instructions that the organisation provides with you. The process starts with you being set up with the MyL2P feedback system, and you will see the screen shown now. Once you are set up, you will then be asked to provide a self-assessment form, which you're going to see on the screen now. This just simply reflects your own insight into your clinical practice. This form, which you can see on the screen now, is very easy to complete, only takes a minute or two, and this just reflects your own insight into how you're providing clinical services. Once you finish that form, you then move on to adding colleagues. Your choice of colleagues can be quite wide. These don't just have to be doctor colleagues, they can be nurses, technicians, managers, administrators, anyone who works with you and knows you as a doctor. So once you've collected your names of 15 colleagues, you then need the email addresses for each of these. And then the next step would be to add these colleague email addresses to the system, and this is quite easy to do using the form which you can see now. There's a space on the form that you just add your colleague email address, and you work your way through the form until you've added 15, and the form will then reflect this. The next step of the process is for you to receive a report based on your colleague feedback that's been provided, and this automatically is uploaded onto the appraisal form and looks as we have shown you here. The first part of the colleague feedback result report shows a number of bars in a table with the various questions that the doctor has been asked about, tabulated again as is shown on the screen now. The report reflects what colleagues have fed back regarding the doctor's clinical knowledge, diagnosis, medical record keeping, etc. The next page of the colleague feedback report from MyL2P includes further data and specifically the comments that the colleagues might have made when filling in their own feedback form, and these can be seen at the lower part of the display. If we then move on to the issue of patient feedback, this is arranged slightly differently to the colleague feedback. First of all, the number of forms you need are 35 forms. This compares with the 15 colleague feedback responses that are required as described earlier. Rather than asking patients to fill in an online form, this is done using a conventional questionnaire of the sort shown on the screen now, and these are provided by MyL2P for you to give to your patients to complete and then return to MyL2P. As you would expect, these patient questionnaires are based on standard documents that are provided by the General Medical Council and ask the patients about their opinion regarding the doctor, making you feel at ease, listening, whether they were polite, and providing treatment decisions that are shared with you. Once you have collected the 35 patient questionnaires, you can then send them to MyL2P, who turn this into a patient feedback report similar to the colleague feedback report discussed earlier. The patient feedback report gives you information collated on the basis of the feedback on the questionnaires. The first page of the report is shown here, and this leads on to a second page of the patient feedback results, which can now be seen on the screen, and this gives similar tabulated data, but also, as shown in the lower part of the screen, it also shows the specific comments that the patients have made about the doctor. I hope you have found this video useful in preparing for your patient and colleague feedback. If you need further information, you can contact my L2P organisation directly. For more information about appraisals in general and colleague and patient feedback specifically, you can contact us through Doctors Appraisal Consultancy. You can see the website on the screen now, and you can contact this using the following link. I hope this has been helpful for you.